Africa with Nterini.
Every headline has a human side. The Journal with Matseko Musito on the African perspective. Your life, your rhythm, your Africa. Channel Africa. Find it for free on Google Play and the Apple App Store. The Health Brief on the Journal.
Thank you for staying with us in this health brief half hour, exclusively so here on the Journal on Channel Africa. Almost 2 weeks ago, the International AIDS Conference in Rio brought together global experts to assess the future of HIV response. It comes at a challenging time as you and I speak, with new advances in HIV prevention and treatment alongside growing concerns, about international funding. So what do the latest developments mean for Africa and South Africa right now, and how can we sustain the HIV response? We speak now to Deputy Minister of Health, Dr. Joe Phaahla, about the key takeaways from this particular gathering and a way forward for South Africa. Welcome to the program, Dr. Phaahla. Thank you very much for the time.
Well, good morning. Thank you very much for having me on your channel. Thank you very much.
Thank you very much for making the time. Let's start with the big picture. What were the most important takeaways from the International AIDS Conference in Rio for South Africa and the global HIV response?
Well, as I think the International AIDS Society, committee really captured, the focus in terms of the theme which they crafted, which was 3 R's: rethink, rebuild, and rise. Now, these were, really premised on the challenges and the opportunities. The challenge of the moment being in the last 2 years, as everyone is aware, in the main way, led by the withdrawal of funding from the U.S., which has resulted, in a number of other, especially state donors, also reducing their contributions. But at the same time, being at the time when, under the leadership of the United Nations, under UNAIDS, a very clear focus and mobilizing of countries, member states, and also all the partners, to say that we must remain focused on elimination of HIV as a public health threat. We know that it's not an ambition to say by 2030 HIV would be eliminated completely, but as a public health threat, and that there are tools which are emerging. So on the one hand, the conference clearly mobilized from the opening. I attended the opening press conference. I was invited to be part of the panelists there, and really the focus was to say there are threats, yes, but how do we rethink and how do we rebuild in this current situation? There are threats, but there are opportunities. So this is really the rallying call of the conference, if I may summarize it that way.
Absolutely. 15 minutes into 11 a.m. If you've just started listening, we're unpacking some very important key takeaways and, the outcomes of what took place in Rio at the International AIDS Conference with Deputy Minister in Health here in South Africa, Dr. Joe Phaahla. There's an encouraging scientific progress in HIV prevention and treatment, Deputy Minister. What developments are coming through as we speak within this pipeline that give us the most hope?
Well, again, and again, just going back to the theme of the conference, the last R says rise, and I think the call of the conference was for all the partners, the member states, the civil society, the scientists, to say, how do we rise out of this situation? Of course, we're conscious of the fact that funding is becoming a challenge. How do we encourage those who have put a lot of money into this effort, which has led us to where we are today, where in the new infections overall have declined by over 50%. The deaths have also declined by over 60%, but there remain threats. What are the opportunities? And the opportunities, which really it was to encourage all those who have been part and parcel of this journey to say, we can't, lower our guards now when in fact there are tools which are emerging, which are telling us that this, what we have said to ourselves that we can achieve, is actually achievable. The one thing which around, the issue of the long-acting prevention, because at the end, treatment is important. We want to make sure that everybody who needs the treatment can get access to it. But at the same time, prevention, we have always said that if you treat, but the new infections keep rising, then there's a problem. Now, there are new prevention tools. As you would be aware, here in South Africa, we also launched the long-acting injectable. It's not the Lenacap, it's not the only one, but it's the most promising in terms of efficacy and also in terms of the fact that it's only two times a year. But there's also even cheaper versions of a once a month tablet by another company called MSD, which is also showing a lot of promises. And we are happy that in both cases, both in terms of the injection, there is also an acceptance that you have to involve those who are highly burdened. You might be aware that, while we were at the conference, there was also confirmation that Gilead, which is the company for the Lenacap, is in an advanced stage of identifying a South African company which can produce. On the tablet side, which is not yet in use, but is still going through the final stages, one of our companies, Aspen, has already been identified by the MSD company to be the local partner to produce. So of course, we would have loved to have a vaccine, which will be a full prevention. That is still, eluding us, but we believe that with these tools, there's a lot which can be done to achieve our targets of 2030.
Right. And finally, just before we let you go, Dr. Patla, let's look at perhaps if you could leave us with one message as a parting shot coming out of Rio, particularly for people living with HIV and those who are at risk at this time. What would you want them to know about where we are heading, especially considering an important point that you brought up in your response there around the cuts in funding, which is quite significant and puts quite a lot of pressure on the future of HIV response going forward?
Well, the message I can leave is that we are doing, as country, as leaders of governments, and also from civil society, and also the business foundations, which have come forward. In fact, in the last Global Fund replenishment, which is a major funder now of HIV programs, TB and malaria, the private sector has come much bigger, including the private foundations. They can't close the gap completely of government donors, but what we can say is that we are doing everything possible to encourage partners who have the financial capacity not to let go now. That's what we're mobilizing. But you are also saying that governments, with all the other challenges, all the other pressures of various competing needs in terms of service delivery, we are urging governments, especially in the developing countries in African continent, that we need to do everything to protect the health budgets and make sure that the gains which have been made, where some of the donors are living, let's close the gap. But also look at efficiencies, that we must also relook at some of those gaps and see where we can improve, and especially invest on prevention. So we're saying that This is the time to really rise, as the conference theme was saying, rebuild and rise, and make sure that we can reorganize. And we are saying it is achievable with also with the advancement in science. But one of the things which we're also concerned about is that as the science improves, we must also not forget the basics of prevention, keeping safe, because sometimes we find situations where when people think that there are these new tools, and then they think that things like condoms are no more important, and then you see sexual transmitted infections and unwanted pregnancies rising. So we're saying the combination of prevention, all the methods, these new ones must just be in addition, and let's be more efficient. If we get more efficient in using the resources available, we can actually defeat HIV.
Absolutely. Deputy Minister of Health in South Africa, Dr. Joe Phaahla, thank you very much. Thank you for giving us some of your time.
Thank you very much for having me. Thank you.
All right. This is us, of course, having a discussion on the key takeaways from Rio and a way forward for the African continent and South Africa, looking at the International AIDS Conference.
Start your day right with Channel Africa Breakfast.
That smells delicious.
Live.